The International Agency for Atomic Energy, which automatically is endorsed by the World Health Organization, considers that that's not relevant, that Chernobyl could not possibly be a cause of spina bifida. Such statements are not supported by investigations in Chernobyl areas that were impacted by Chernobyl areas. So, why not Chernobyl? Is it just a hypothetical, theoretical position? Yes. OMNI-Net was created for many reasons, but among them was, does Chernobyl cause developmental disabilities? Yes or no? And that includes spina bifida. Here is a map of Europe and all the network of EuroCat, of which we are full members. This adds credibility when we monitor disabilities in Ukraine the same way like in Paris or Berlin or London or anywhere else. I think it's important to underscore that spina bifida in Ukraine, its frequency is elevated above all the other areas in Europe. Sort of a provocative contrast. The following observations of thousands of patients and thousands of women who underwent measurement of their incorporated radiation would not have been possible, and therefore we must acknowledge with gratitude most healthcare professionals in Rivne who voluntarily participated in our efforts. Furthermore, this was made possible by an endorsement of the Ukrainian Ministry of Health and contributions of a large host of international experts. Thank you to all of them on behalf of all members of OMNI-Net. So let's look at some facts, not hypotheticals. In Rivne, there were 320 infants with spina bifida, representing about 5% of those across Ukraine, meaning that in Ukraine there were about 6,400 infants with spina bifida. That is not a small number. That is an epidemic. Neural tube defects, to which spina bifida belongs to, were observed in 542 infants, representing at 5% frequency in this province of 10,800 in Ukraine in general. Well, let's look a little further. Spina bifida and polyscia, the frequency based on a population base, that is among all Ukrainians, all Ukrainian infants, that is, represented 12.6 cases of spina bifida among 10,000 births, much more frequent than in North Polyscia, which among 10,000 births was about 8.67 births. And in Europe, among 10,000, there were infants with spina bifida born about 5 times in 10,000. Why? Ask why. And can it be reduced? Answer, absolutely. The frequency in Polyscia and North Polyscia should be less than 5, because it is lower in countries that fortify flour with folic acid. So, fact 1 is hardly disputable. Spina bifida is highest in an area polluted by Chernobyl. Well, maybe it is due that the women drink more there, and therefore that's why you have it. They worry about the radiation in Policia, so they drink. No, but actually, when you measure pregnant women and how much in their body is their cesium-137, you see it is 3 times higher than in not Policia. Each molecule of cesium-137 explodes in that mother, explodes inside of that embryo, and causes damage. On another perspective, while some women eat more radioactive cesium than others, women that love to eat mushrooms may have more incorporated cesium than women that don't. So here is another statistic. Women that have over 100 becquerel explosions per kilogram of their body weight, 382 in Policia compared to only 8 in not Policia. What kind of babies are they going to have, these 382 pregnant women? How many of those babies are going to be dead? How many will have spina bifida? Is that something we don't want to know? Ask yourself. So we come back to the same question. Women should not be exposed to radiation, whether they know it or not. They may be pregnant. In fact, you should not be exposed to radiation because it's carcinogenic. But we're talking about babies, we're talking about embryos. Why not Chernobyl? What's wrong? We know that radiation will cause spina bifida and microcephaly. Why not? We should perhaps explore that further. So here are some facts. In Policia, spina bifida was statistically significantly more frequent. In-utero exposures to radiation of embryos was statistically significantly higher. In Policia, other NTDs, such as craniorachis were statistically significantly higher in Policia. In Policia, microphthalmia and microcephaly were statistically significantly higher than in North Policia. So how many facts do we need? And we have them. Why not Chernobyl? We're going to talk more about the why not in part 2. But since this part is focused on spina bifida, let's talk about 2 things we can do right now, tomorrow morning. It cannot be done without you. It cannot be done without Ukrainians. This is not the responsibility of Putin or any government. It is the responsibility of everybody. 1, we can reduce radiation exposures by eliminating the sources. And the sources are water and nutrients polluted that pregnant women swallow or inhale. The Ukrainian government has discontinued the monitoring of the sources of radiation for pregnant women in the areas contaminated by Chernobyl. Why? Well, they follow recommendation of international agencies. Why? Find out. The second thing we can do is to reduce the frequency of spina bifida directly. How? By adding folic acid to flour. Well, why to do that? Well, there are over 100 countries that are doing this, and you're going to hear more about it from Dr. Rosen. And they all have demonstrated that it is safe and that it is effective. Why don't we put folic acid in flour in Ukraine? Why? Ask yourself, why? So I have run out of my time. We'll continue in part 2, exactly 1 week from today at the same time. Registration announcements will be promptly followed this webinar. And I hope I see you then. But before, I have a few little things to add. So, OMNI-Net, as stated, was dedicated to science, to find out facts, and to disseminate information, how to diagnose, care, and prevent developmental disabilities. But things have changed. The change is war. And during war, OMNI-Net has to change. And the change is that we need to shift our attention to assistance, to care. And to do so, we need your help in order that we can help. We can help others, but not easily without your help. And are we doing something? Well, we are doing quite a bit, given that our resources are very limited. We are not a state institution of any kind. We have no connections to any government, and therefore our resources are minimal. But we have distributed over 25,000 urinary catheters free of charge, and pay as we may. We pay as we collect a few dollars here and there. But we cannot afford to buy cerebral shunts. It's sort of a halfway help. You know that spina bifida has problems with the urinary tract, and that's exactly what these websites are about. But they also have hydrocephaly. Are we just champions of a half patient? We don't want to help the whole patient, we just want to help the lower half and not help the upper half. It doesn't make sense, does it? Very often, professionals say, well, why don't you call so-and-so? Why don't you write so-and-so? Why don't you ask for help from such and such agency? Yeah, sure. We can do so. So can any of you. But the issue here is that our professional colleagues should have their own sense. They can make a personal contribution more than just recommendations. So I invite you to join other professionals, because without them, we would not exist. Help us to help others. And now I wish to thank you for your attention and invite you to see part 2. And of course, to make a personal contribution so we can continue our work. Thank you, and thank you again.